Hi, everyone, and welcome to another episode of our Global Ambassador interview series. I am Luisa. I'm the project manager for the G20 and G7 Health and Development Partnership, and I'm here joined today by Dykki. Hi, Dykki. Thanks for joining us. So we will start with a short intro, if I can ask you to introduce yourself and your role, and then we will proceed with the interview.
Well, thank you very much, Luisa, and thank you for inviting me to talk with you today. I'm really excited about the conversation. My name is Dykki Settle. As you said, I am the Chief Digital Officer at PATH in Seattle. And in the context of the partnership, I serve as the partnership's Global Ambassador for Digital Health.
Thank you. And also you sit into our subgroups and you do usually an amazing job of kind of directing the subgroups and the recommendations. So thank you for your help in that. Right, to jump into the conversation. So in your opinion, what do you think are some of the major global health challenges that we face today? And you know, if you can just add, why do you think we need to tackle them?
Great, thank you again. We've got some phenomenal challenges facing us, and it really helps if we can look at targets and progress in relation to targets. And probably the most substantial one for health is, of course, the Sustainable Development Goal of health for all by 2030. That's a real ambitious challenge. However, if we look at the current state of health systems in the world today, many of them are still very fragile. One of the most enormous challenges is the shortage of health workers. I believe WHO has identified a shortage of as much as 10 million health workers worldwide by 2030. And those two curves don't match up at all if we are really looking to deliver health services in the traditional way that we have around the world. So we've really got to find some new ways and approaches to deal with this challenge. So again, I don't believe we can ramp up production or improve retention of health workers to close that gap, particularly in the time allotted. If anything, the gap has been getting worse. So we need to find a transformative way to really help improve the reach, the quality, the affordability of health services beyond depending on traditional one-to-one health services. Thankfully, we've got some ways to approach that, which I'll come back to later. But that weren't enough of a challenge. We have tremendous health impacts that are coming as a result of climate change. It's really important to recognize that as climate change advances, we're not only going to see those direct impacts of heat stress and weather impacts to health and well-being, we're also going to be seeing changes in the epidemiological patterns, particularly in insect vectors like malaria. We've already seen here in the US the presence of malaria and Zika and other mosquito-borne illnesses that we had not seen in past decades. So we're really going to be seeing a change in the epidemiology of diseases in places that aren't ready for them as a result of climate change. Again, I mentioned that we're going to have some opportunities to take advantage of, but also some risks associated with those opportunities. As the global ambassador for digital health, I'd be remiss if I didn't talk a little bit about the emergence of AI as a really transformative force that's coming to the way we interact. Already, digital transformation has been a very important priority in global health to make sure that that digital divide, as I served as a commissioner on the Lancet Financial Times Governing Health Futures 2030 Commission. And in that commission, we made the case for digital as a new determinant of health, along with the other social determinants of health, which means we're at tremendous risk to health equity. If digital is a determinant of health, those digital haves have a greater opportunity for health and well-being than the digital have-nots. And so we're going to need to close that digital divide to keep it from exacerbating the pernicious health equity challenges we've been facing. So starting in the larger context of the challenges of the health workforce and fragile health systems, looking at a great contextual shift with climate coming in, and then this shifting, constantly changing world of digital transformation, and now the rapid emergence of generative AI, and recognizing digital as a new determinant of health, we're going to have to work hard together to really close these gaps and address them successfully.
And that also means adopting, where you mentioned an innovative approach, not only in the way that innovation, not just in the challenges that we face, but also in the way we approach them, not in silos, but towards like a global perspective, and in the international fora, and going into the importance of having a global approach, not a siloed approach anymore, but looking at health as a 360 challenges in a way, including climate change. What do you think? How do you think it's important to, and how do we engage with the G20 and the G7 presidencies, which are G7 plus, G20 plus presidencies, and why it's important that we push for convergence between the agenda of these two organizations?
Great. Great. So it might be tempting to think, okay, why do we need to lean in so hard on such a broad spectrum and so removed from so many of the challenges I spoke about with the G20 and G7, which is, of course, comprised of the most upper income countries.
Yeah.
And it's extremely essential that these countries are aligned in their agenda to make the kinds of investments that are really going to help support the countries that do not have the kinds of resources that G20 and G7 countries have. I think COVID showed so clearly all of us, any of us are only as healthy as all of us. And so we really need to address and think about health as a global problem. And really the worst thing that the G20 and G7 countries could do would be to turn a blind eye to the global realities. Diseases know no borders. And so we need to truly invest in and align our investments in the kinds of support to all of the countries, to everyone, and really help realize that health for all. And so really leaning in on those convenings, being able to set the stage, having the countries align and coordinate their investments, provide the kind of guidance they did in last year's India presidency to multilateral entities like WHO with the Global Initiative in Digital Health, are exactly the kinds of initiatives we want to see emerging from these agenda-shaping, investment-setting countries like the G20 and G7. And for the same reason, we can't have these two groups, the G20 and G7, have separate agendas or separate priorities. As much as we can work to help align them and focus them on the relative priorities, I think that's going to be critical. It would be terrible if we had the G20 totally focused and aligning and setting an agenda, and we have the wealthiest countries, if I may be so direct, in the G7 deciding that they want to invest in a completely different set of priorities based on their conversations in the G7. So I'm really pleased to see the G7 added to the G20 and G7 Health and Development Partnership, and looking forward to support strong alignment and coordination across both agendas.
Thank you, and that's exactly why we added the G7, and what we kind of like have pushing forwards to converge. As you say, there is no global advancement if we're looking in different direction, and global health is an issue for all. Staying on the partnership, as you mentioned, you are one of our global ambassadors. You are very active into our digital health subgroup. So why do you think platform like ours, and specifically the partnership, can support with creating a convergence on the international fora and advancing, if we do, the global health agenda and the SDGs target?
Great question. I'm just a huge champion, as you said, of the partnership, and really work closely with you all. And you've been so open and responsive to working together to get aligned and to get that focus. We've seen over the years, different actors have come in with their own agendas. And we've seen them individually try to impact and influence the G20 and G7. It's so easy for any individual organization or company to have their voice lost in all of the actors who are trying to get the message together. The partnership offers an opportunity for different organizations and companies to come together and align and coordinate and make a convergent ask to help really make a louder, more prominent voice into the G20, G7 deliberations and declaration. And the partnership, both the Secretariat guides all of us in what the processes are and how to have the most impact, helps convene us and bring us together with the right actors, and really help us ensure that we're keeping health equity front and center in the minds of the countries attending the G20 and G7. So I'm really grateful it exists, and really excited to continue partnering and helping us have the greatest impact possible on some of the goals I mentioned earlier.
Thank you, Dick, and we're very, very glad for your support. And that's exactly what we strive to achieve, like, this convergence and the unite agenda. So thank you for joining us today. As I said, this is just the start of our Global Ambassador interview series. So we will talk to you again. We will share you again. And thanks again for your help today.
Great. Thank you very much, Luisa. Talk to you soon.